If I'm way off, just say, Sean, here.
So you are currently live. Just
Okay.
so you know.
Awesome, thank you.
To stop. And then you really go back to the comments. And I'm going to send you a text comment from and so no one needs to the public comment. That's what we do. Okay?
And
And
then
then I'll have my phone
need to shut it down when we're done.
Yeah.
Okay, you got that figured out?
Mm-hmm. Here, end stream.
Okay.
We'll shut it down on YouTube and then we'll go to the
Okay. Awesome.
All right, you're good.
Like trial by fire.
You're right.
Thank you, Nicole.
Thank you, guys.
Are we ready to roll? Yes?
Yeah, we're live.
You're live.
Okay, call the Broadwater County Board of Health meeting to order. It's 1:10. We had some technical difficulties. We've gotten them taken care of. Let's go right off the bat. Is there any public comment? Seeing none, we will go to COVID-19 plans, COVID-19 updates. What do we have? Anything? The stroll?
So we do have a few things that we're going to talk about with COVID-19. I don't know if we don't have any plans that have been presented to us for any for our review or for the for you to kind of give a yay or nay for. So we can either go into talking about the Toys for Tots and some of the other events that are kind of people are looking for some guidance on, or we can do that later. It's kind of up to you on where you want to put that into the agenda.
We can do that right and get it all taken care of.
Okay. And I was kind of expecting the person from the Toys for Tots to be here. It is my understanding, and I think Daryl knows from being on the fair board, that the Toys for Tots program in Lewis and Clark County has been told that they are not going to be able to do their program in Lewis and Clark County. And so they have reached out to us, the Board of Health, and also to the Fair Board to see if they can do that event through Broadwater County and through the fairgrounds and Fair Board. So it's something that we're going to have to take into consideration. Now, when this was put on the agenda, we didn't have the most recent directive from the governor. So I think some of the things that we talk about for Toys for Tots may actually be kind of relative to what we also talk about the most recent directive. And so I think we need to kind of keep that into consideration. It is my understanding that the Toys for Tots program in Lewis and Clark County gifts to over 600 families in the at Christmas time. And so it's a very large program, and I can tell you, having a couple years ago helped sort toys at the Salvation Army, it is a very big endeavor. And that gymnasium, which is a very large facility at the Salvation Army, is full of toys. And then I imagine, and I wasn't at the process of where they're handing out the actual toys to families, but I imagine it is also a very large endeavor. So I think if anyone comes forward with a plan for this to happen in Broadwater County, it's going to have to be very well thought out, very well organized, and something that I'll be talking about when I talk about the election process at the fairgrounds. It's going to have some strict enforcement of the guidance that we're following in terms of mask usage and social distancing. So because they're not here to discuss that, and maybe they will show up, I'm not sure, or call in. I don't know if we have the ability to call in. Helen, I guess we can look at and see if anybody comments from there. If they're watching, I'm not sure, but that's so Toys for Tots, and that would be a very large event that will take some considerable thought, but it's also one of those things that we all know that as a community, sometimes we have to figure out a way to make something happen, if it can, because it's important to the community. So, my personal feeling is, my gut instinct is like immediately just to say no, because that's the easy answer. But I think it's definitely an event that we should give due consideration, and if we can get organized, I would personally donate time and effort to be there off of my sanitarian position to help do that, because I think it's an important thing for both Lewis and Clark County and our community as well. So I think, do you have anything to add, Daryl, to that? Maybe you're at the Fair Board, was there more talk about that?
Yeah, there was, and I guess, realizing that this is going to be such a big endeavor, that the talk was from the Fair Board that they were willing to donate the use of the fairgrounds building at no addition, at no cost, which is awesome. But thinking about the scale of how this is going to be, that may not be a large enough facility to do this. So I guess in our minds, we need to think about where we could do that. I guess one thought was maybe possibly inside the roping arena, the barn, would give plenty of room for people to spread out. If that would work for them, of course, it's a little bit weather dependent. Is it going to be cold? We don't know. Could something like that work? I don't know. I guess maybe we just need to be creative and still try to follow the guidelines that we have to work with.
And as we know, it's tricky because we have volunteers that are going to be helping out, and if volunteers, all of us are, at any point could be put in quarantine, and so the volunteers could easily. So it's going to take a pretty strong effort to come up with a plan and some guidance on this. So I think. It may just not be possible, as much as I think it's an important event. It may just be logistically not possible, especially thinking about how full that gymnasium was up at the Salvation Army. So,
yeah, I agree, Sean, that I believe that it is an important event, and if there's some way we can pull it off, I really like to try. So.
Do you have a date on this event?
Is it 16th, 17th, or is it 17th, 18th, 19th? I can't remember.
Yeah, and that's, as Daryl and I kind of just talked about it briefly because he had been on the fair board or at the fair meeting. That might be something that has to be lengthened out too, just to minimize contact with families, and staff and that kind of thing. So that's something that's going to have to be thought out. 600 people over 3 days is still a lot of people, or 600 families. So,
Yeah. Okay.
So do you know how that program works when they do the dispersal of the toys?
I don't. I feel like when we were sorting the toys, we were told that families you kind of get a card or something that says, how many kids you have and how many toys, and then they have bins, and you can pick so many toys out of this bin and so many toys out of this bin, maybe a bike or something like that, and then So
would it be feasible to break those groups up and to say, how many people can you put in that 4-H building with 6 foot distancing?
Well, I think logistically with all the toys, I don't know. I think it's because even though you're 6 feet, if you have people moving, that's the issue is that, you almost need to have just a straight flow. You'd have maybe 2 aisles going and have stations or something. So
do all these people pre-register?
I believe they do, and so that's why I think we could set times.
Would it be possible to give them like 30 people 15 minutes and then give them, somehow get back to them and give them when their appointment is?
Yeah, so
I'm sure you're gonna have squabbling about they didn't get a pick first, but that's how life is.
well, I think that's standard anyway. I think, it just,
Yeah.
that it's not a first come, first serve. I think you're already told. I think it's been that way with, I imagine if there's 600 families, that it would be tough
Yeah,
to,
if they could schedule them that way, then you could just run them through there in 10 or 12 groups, and you wouldn't have people standing outside the door freezing, and then they can just sit in their car until it's ready for the time for that group.
yeah, I think it's, like I said, I think it's possible, but there's just so many places for things to not be adhered to. And that's,
Yeah. Okay, well, I think a lot of those things that Mike's talking about is something those committees are gonna have to develop to bring to us.
Yeah.
I mean, we can certainly give them some ideas.
yep.
I think that's what they need to do.
Another thing may be, if you could have it in a roping barn, you could have them do a drive-through with toys on each side and then have them just come right through the building. You wouldn't have to get out of the car other than to get the toy.
Yeah.
So they're gonna bring us a plan, is that what they're gonna do?
That's my understanding, but I think the last email I got from them was, because it's the wedding planner folks, I'm sorry, I can't remember their name suddenly, but, yeah, Stacy, thank you. She's the one that's kind of trying to head that, and she's done a bunch of plans for the wedding event center, and she was looking for some guidance, like, where do I even start? So, and I can give her that, some guidance to get her started. But I think we really wanted to see if it was something that the board was willing to put some effort into helping them come up with a plan.
I'd like to see it happen as long as we can pull it off without causing any event.
With the amount of toys and the people, the counties involved, is it unreasonable to look at it over a 2-day period at all?
Yeah, I think that we
Just as
extend it as
options for
long
them to
as we
look at.
can. Absolutely.
Yeah.
Yep. Absolutely.
Well, good luck.
Okay, go ahead.
She said, yes, they pre-register and they can be given a scheduled time to arrive.
Okay, so that was Bobby. She said that they do pre-register and they can be given a scheduled plan to arrive. Thanks, Bobby.
So that's the only plan in terms of the COVID that we have going on. Now, we do have, and I know that I think we'd like to talk a little about the Christmas stroll and see if there's anything based on the new guidance. And so you all, I assume that you all saw that there was new guidance. And the guidance basically has a couple points to it. One is that restaurants have to close by 10. Restaurants and bars have to close by 10. They have to go down to 50% capacity. And then there's another component where no groups greater than 25 can be, can hold events, unless, it does say unless a plan is approved by the local health authority. And so, and that's no change other than the number of people. So public gatherings and events limited to 25 individuals where social distancing is not possible or observed. And then the face coverings are required in all counties regardless of the case count, which doesn't affect us right now. But so I'm sure Debbie would like to know a little about if we have any thoughts on making a change. Because it wasn't on the agenda and it kind of just hit us, I would say that maybe we should review the plan and get it back. That would be my recommendation. I hadn't really had time. Do we want to go through that now, or do you want to take time? If you remember, I feel like they'd already done a pretty good job of making sure. I think that the only comment that I will have is there has to be a strict adherence to the face mask requirement. And after being at the election, that doesn't always happen. And I think it's very important that if we're going to approve these things, that we see strict compliance with that. And so if you want to talk a little about that, Debbie.
Just real quick. If any of you were at the Ghost Stroll
We walked around, we kind of took turns to make sure that everybody we saw was wearing masks. They were told they had to, and had to play by the rules so that we could have the Christmas stroll. Christmas stroll, if you don't have a copy, I brought extra copies. It's outside, and the numbers will be outside. We'll do a parade, a quick little parade. The numbers will either be on a float. Let's say the drugstore has a float. Their number will be on the float. And then at the end of the parade, down Broadway, the float will be sitting there for 2 hours. So people can check their numbers. Mask required. No homemade food will be given out. The vendors will still be in the locations if they want to, selling their Christmas crafts or whatever. So we tried really hard to make it outside as much as, everything's outside actually.
Yeah. I think that's what makes it work, for me anyway, the fact that it is outside, so.
And, just to be clear, if, let's just say Shirley Wilson's quilt store, she's going to have a vendor in there, one vendor. And everybody will get a copy of this, the plan, tomorrow, if everything's okay. So I was happy that I don't think the governor's change yesterday changed anything for the stroll as far as the chamber is concerned. Do you have any questions?
How do you enforce the mask?
We just really ask and ask. And we were all really happy that the vendors know they want to do these.
Yeah.
So if you don't want to do it and you don't want to wear a mask, I talked to somebody yesterday and he said, I'm not wearing a mask, that I'm not going to do it. And he was honest about it. He doesn't want to wear a mask, so his store, his location is not going to be open because we just said you have to.
Thanks, Debbie.
Thank you.
So we want to have a vote on that plan then, or how do we want to handle that one? Because that's like next weekend,
It's
right?
December
2 weekends?
Yeah, we've,
Mhm.
Sean and I were emailing, kind of basically what 10 days ago said, looks good.
Okay.
And we've ordered everything.
Yeah, that plan was already passed by
Yeah.
you all.
Oh, okay.
Yeah. But I
Okay.
just know that yesterday, the governor, we might have some new questions. So we did not change the plan at all from what you saw.
So I would agree with Sean that we need to have a strict enforcement of the new governor's directive as far as masks go. But other than that, I think it'll be a worthwhile event. I think hopefully it gets pulled off with no problems.
I guess the thing I'd like to add is on the mask thing, the folks that approach us with their plan for these events are the ones that have to ensure that it's adhered to. I mean, we as individuals can't be going around and doing that. And if they want to have this event and they come to us and we approve it, then it's up to them to make sure that happens. I guess that's kind of how I feel about that. And it sounds like, Debbie, you guys are on that.
And the chamber board recognizes that.
Yep.
So they're taking it upon themselves to try to enforce that the very best we can.
Perfect.
Thank you, Debbie. Okay, so I guess we will move on to old business. Public health officer, you got anything, Doc?
Well, the old business is the same as the new business. I've noticed that the increasing numbers and the mask problem is just something, I don't know how anybody can deal with it. I've noticed people that come up positive walking around town, the isolation stuff, it's not universally adhered to. And I don't know how they have to get them to change that.
Yeah.
Sometimes people are just not edge.
Okay, thank you. Public health nurse,
I don't have any old business.
okay. Any board members, anything from board members?
I guess one thing here, I have to exclude myself from the vote for the Christmas stroll as a member of Chamber of Commerce. I have a conflict of interest.
Any other approval of minutes dated October 21st? Does everyone get a copy? Entertain a motion to approve.
I'll make the motion to approve the minutes from October 21st.
Is there a second?
I'll second it.
Motion's been made and second to approve the minutes for Wednesday, October 21st as presented. All in favor? Aye. Opposed, same. Motion carries. Send that down and bring it back signed. Send it back through. Old business, county sanitarian.
Okay, the only old business I have is regarding the Board of Health training, and I've been in touch with Carrie Pride from the Department of Health and Human Services, and she actually had hoped to have something put together for today for us, which is probably okay that she doesn't, but the next meeting, which is December 16th, she is hoping to have a presentation put together for us, and it may be, I'm guessing it's going to be via Zoom or something like that, but she's going to try to have it for the next meeting. If that does not seem to be a good time, please let me know, and we could push it to January, the January meeting. She said it would be about an hour of our time for that, so I felt like that was okay to put in with our Board of Health meeting. If that's not okay, also let me know.
And we can have that in here, but that TV's set up for Zoom now, so we can do it here with everybody in the room. So what's
Perfect.
everybody's feeling on, do you want to do it before, or you want to do it wait until we do it after the New Year's?
So that'd be an hour on top of our regular meeting?
Yeah. Or do you want to, I realize you guys get stuck here, but do you guys want to do it on a different day than our meeting? So that we're not in here for 2.5 hours?
Can we do just to throw it out there, the Zoom meeting like after 5?
What's that?
Can we do it after 5? Is that a problem with anybody, or?
Would Mako have a problem with doing that after 5?
I can find out.
Well, I just don't know how the other, if that works better for anybody else.
Well, I think that's probably a good idea, because I think in reality, we should end up with a fairly good discussion of what they want us to do, what they're gonna teach us to do, instead of, now we're at the end of the meeting, so we had an hour on, everybody wants to get out.
Or
So
a different day or something.
Yeah. I'd be in favor of having that in a separate evening meeting.
Okay, and does, for other folks, do you all have the capability of doing a Zoom call so you could do that even from home in the
Sure.
evening?
That's a possibility. Do that.
Because if they're going to do that, we could make it easy on all of us, in fact. So, okay.
I would definitely prefer Zoom. It would. I really struggled hard last meeting to hear what people were saying.
Got it. Okay.
Do we want to do it after the first of the year, or do we want to do it before? Myself, I would prefer we did it after.
After. That may be better for everyone, as things are going to only get crazier once the holidays, even with that. So I'll mention that to her.
Okay.
Great. Thank you.
Thank you, Sean. Okay, now we'll go on to new business. Report from Public Health Officer. Yours is new, as same as the old, right,
Same
Don?
as the old.
All right. I'm gonna have to remember that. Let's see, report from Board of Health members. Toys for Tots, we've covered the 2020 election process at the fairgrounds.
I'll put that under, that's actually my agenda item, sorry, so
I'll Okay.
skip that and we can go
Okay. And then the amendment to the 2020 cooperative agreement.
Yes, we can do that now. So the cooperative agreement is our agreement between DPHHS and, so the county and DPHHS to do, inspect the licensed establishments, bars, restaurants, trailer parks, campgrounds, that type of thing. Due to the COVID pandemic, they have agreed to do an amendment to to that contract, which would allow for all of the time that I've been spending or we've been spending working with the bars and restaurants, for that to count as our inspection. So typically we have to do one full inspection of each of those facilities every year. And what this is allowing is, because we couldn't do, they really had come out at one point and said, don't go out and do inspections right now, just do it over the phone, or because they didn't know how we were going to do those types of inspections. So this amendment will allow us to count all of the contact time that we have made over this year of the pandemic, and it gives us the contract money in full for doing all of that. So, I mean, to me, it's I'm glad that they were willing to do this, because we have spent a lot of time. You know, every time there's a complaint, there's a follow-up, there's all those. So this is allowing us to not have to worry about the actual inspections. Now, just so you know, we had done a lot of inspections early on in January. So that was good that we had already gotten some of those done. And also, typically what I try to do, like I've been down to Wheat, Montana, I just go through and make sure that the important things are being taken care of. Temperatures, you know, is the food being held? Is it being cooked properly? And then hygiene, you know, which of course is a huge thing for COVID anyway. So it's really just getting out there and doing some education, but quick, I won't say quick and dirty because I hope it's not dirty, but quick inspections. But we've really been, most of the facilities in this county have been in communication with our office throughout this, whether they like it or not, but we've been, you know, in communication. So I think that this is an important amendment to get signed, and we'll get going on that. So any questions for me on that?
There's no question, then we will entertain a motion to approve the amendment for the 2020 cooperative agreement.
Okay, I will make the motion to approve the amendment to the 2020 cooperative agreement.
Is there a second?
I'll second it.
Motion's been made and seconded to sign and approve the amendment of the 2020 cooperative agreement. Is there any further discussion? Seeing none, we will move to a vote. All in favor? Aye. Opposed, same. Motion carries. Okay, report from the public health nurse.
Okay. So we currently have 144 total cases of COVID in Broadwater County. Our current today case is 32. We had our first COVID case related death yesterday. We also have one that is on hospice, is likely to recover. Montana has 49,398 current COVID cases, 543 deaths, and 29,105 have recovered. So our recovery rate is about 58.9%. We have only given 354 flu shots this year. We expected that to be actually much higher. Although we do have another provider in town giving influenza shots, so we kind of did expect, you know, some variation in that. But I want people to remember that you're 7% more likely to die from seasonal flu than you are COVID, so make sure you get your flu shots. We currently have only had a couple of positive flu cases in Broadwater County so far. So that's good. So far we haven't had a big clash in COVID
and flu cases. Many places have started doing the Binax testing. I don't know if you're familiar with that, but that is a new rapid test for COVID. It's kind of like a pregnancy test. You still get a swab in the nose. They put it in a little credit card device, and you get your results in 15 minutes. Leota and I were just talking about that. Our incident command team with Lewis and Clark and Broadwater and Jefferson County public health departments decided that we were not going to do the Binax testing. It sounds really wonderful, but we just don't have the staff. No public health departments really have the staff, although Missoula County is doing them. I got one from them yesterday. And the only downfall to that is the negative cases still have to go to the state for testing. The positive thing about that is that you know within 15 minutes if you have COVID. It would be great if, you know, if we had someplace in Broadwater County where we could do those tests. I really think it would be a game changer, but you know, the hospital doesn't have the staff, we don't have the staff, so right now we're not going to be doing that testing as far as I know in Broadwater County at this moment. That might change, but anyway, the positivity rate for COVID right now in Montana is 27.3%. That's up from 14.8%, and you know, that's obvious because our cases just keep going up and up and up. So kind of what I wanted to talk about today, since we're live streaming, is I'm not usually a Facebook person, but I hear comments quite a bit about people talking about Facebook. And some of the comments are terrible. They're mean. We are just trying to do the best we can. Maybe this isn't a good time. We're all tired. We're working weekends. Leota knows that. Evenings, holidays, and all we get's complaints. People don't appreciate what we're doing. And we try to get the numbers out there as best we can. They're on the Broadwater Reporter. On the DES site, and you know, that's the best we can do right now. If people want to know what the numbers are, they can call. All of my staff knows what the numbers are, so if they want to call, they can. I think what people don't understand is how much work really goes into it. Just from the time that they hit our desk until the time that they're discharged, it's a lot of work. So I just want people to be nice and be understanding.
Keep up the good work.
Thank you, Teresa.
Teresa, I do have a question, if you wouldn't mind asking. Thinking down the road, you know, we hear all the talk about the vaccine that could be coming, and right now they're saying probably April, but who knows? I know that we have a process in place for when those pods are delivered. We have our policy current and up to date. And I know that possibly there may be some concern that maybe not all policies are up to date to receive those pods. Is that accurate?
All of our policies are up to date.
Okay.
The only policy that I haven't seen is the hospital's policy.
Okay.
And that's a really important one because public health will be actually responsible for doing assisted livings, home visits, and the entire community.
Okay.
And so we have to have a plan with the hospital so that they can, you know, do their own pod.
Okay.
When we get the vaccine, then, you know, we are supposed to have this plan with the hospital so that we can just deliver the vaccine to them and they will be able to run a closed pod within their facility.
Okay.
And I know they don't have time to do it any more than I do, but, you know, and it's gonna happen soon. I have the paperwork on my desk right now for, to sign up for the vaccine. And it's not something we have to do. They're actually asking us if we want to do it. I don't know what the alternative is. They didn't tell us that. But I feel like that's, you know, that's something that we need to do. Public health for our community is once the vaccine becomes available to the community, we need to be able to get it out there. And that too, like Sean said, it's gonna take an enormous amount of staff, volunteers and help and everything, you know, to pull it off.
Okay.
For 6,000 people or however many we have, you know, to be able to come and get vaccinated and do it in a manner where everybody's not spreading COVID. So it's gonna be interesting, but we are proactively working on that. The state plans went out to the CDC and I believe they've been approved. And so we are actually, like I said, I'm in the process of filling out the forms to get the vaccine, to sign up for the vaccine for Broadwater County. So we'll go from there, I guess. It sounds like the CDC is gonna provide the storage units, because I'm sure you've heard they have to be like 91 degrees below zero and all that stuff. They're gonna provide PPE, you know, the whole works for us. So, you know, I don't want everybody to have to travel to Lewis and Clark or somewhere else. So, but it's gonna take a lot of work.
I guess as we get closer to that date, I mean, be sure, so this board can assist you in any way that we can. You know, and just let us know. Okay. So, go ahead and read them.
Okay, so Bobby from the Broadwater Reporter says, I understand the reason for the difference in the official active cases reported in the county versus the state map. But will Teresa please explain for the rest of the public? And the next comment is, I appreciate Teresa taking the time to work with the newspaper as we report the actual official cases in the county on a daily basis.
Okay. And I get those calls too, Teresa. People ask me why our numbers are different than those in the state. We've talked about this numerous times, but it's worth mentioning again why there is that little discrepancy.
You know, I've asked the state, and they just kind of run around it. And, you know, I talked to Shelley Mag from Lewis and Clark County, and, you know, she gets the same information. I've never looked at the map myself, but, you know, I hear them say, oh, it says 70 or it says 80. And I said, are you sure that's not total cases, you know? And they're like, nope, that says active cases. I don't know why. We try so hard every day to discharge all of the cases who are no longer COVID active. We might be a day behind or 2 days behind, but never further than that. We have 24 hours to get in contact with all of our active cases. So I had 11 this weekend. So, you know, it took me 9 hours to do 7 of them. And, so I don't really know where the discrepancy is between what the state map is and what is really going on. I don't have an answer because I get a runaround from the state. But we put all of our information into a system called the Montana Infectious Disease Information System. And, you know, we put it in there every time we admit somebody and every time we discharge somebody. And so, you know, if my cases say there's 33, then there's 33. And that information is supposed to be rolled over to the map. But where it goes wrong, I really don't know. And I wish I could explain it. I just can't. But I think more than that is that, you know, I do let Bobby know every day. I let Brittany know every day. That's one of the first things I do when I go to work is I count the cases and so we can get them out to as many people as we can. I started my blackboard is sitting out in the rain today, says active COVID cases 32. So when people drive by, they can see how many cases we have. Other than that, I don't really know what to do. I think, you know, what I was going to talk about was Facebook. People just don't have anything better to do than gripe about what the state map says. You know, do something to help. Just, you know, quit bitching about the state map. I can't change it. A lot of people think it's political, like, oh, they're just not discharging people just so they can make it look bad. Really? Because that's so not true. And if people believe that, you know, I mean, then we all just as well quit the fight. So I wish I had a better answer for you, but I don't. Because every time I ask, why is the map different than what we have in our cases, and I don't really get a very good answer. So.
Thank you, Teresa.
Thank you.
Teresa, I got just a comment. Megan just got back to me. We've given about 90 flu vaccines over there. So if that'll add to your numbers, that might give you an idea where we are compared to last year.
Yeah, because, you know, you know, I usually do a count and have that up to date for the Board of Health every year, and obviously we just haven't had time to keep up with that. And I know, I think the hospital's probably giving more than they used to too. Yeah. And the important thing is not who's getting what, it's just that everybody's getting vaccinated. And so, but when our numbers are low, then I think, you know, I hope people are getting vaccinated, because this is, you know, Doc can attest to this, that, you know, the COVID virus right now is looking like the common flu. You know, we have to put in all the symptoms in our investigations, and, you know, almost probably 4 out of 5 people say, I just have a head cold. All I feel like is I have a head cold, or I have a headache and a sinus infection. And so you can see where the crossover would be very, you know, it's just like the flu. There are some distinguishing, you know, factors. So the people that are getting really short of breath and, you know, the fever and stuff like that. But some of the symptoms that we saw early in COVID, we're not seeing so much now. Would you agree? You know, it is evolving. And so, you know, people think that they just have a stomach ache and they have a headache and, you know, still going to work, and then they end up with COVID, and then we have 20 people to contact trace. So,
Well, I think you'll see that the numbers will be higher. I've seen people that have not got flu shots in the past getting them this year. So I think time you add up everybody that's given them, I bet your numbers will be higher.
I hope so. That's for sure. Yeah.
people that are tested positive out in the community. Is there any, when they test positive, are they still told to quarantine for 14 days?
Absolutely. The people that are positive have to isolate for 10 days from the start of their signs and symptoms. Anybody who is a close contact of them has to quarantine. And so here's a good example. We had a woman and a child test positive on Halloween Day, and I had 5 phone calls to public health the day after Halloween that everybody knows it's a small town. We don't tell anybody. We follow all the HIPAA rules. But 5 phone calls came in and said, I saw so-and-so and her kid out trick-or-treating, and they both tested positive for COVID. I can't be the police, I can't, I wish I could, but that's just the way it is. People aren't taking it serious, and, Facebook, I just scrolled through there on my lunch hour and wrote these notes, and, people are saying things like, they're doing it on purpose, it's all political, masks don't work. Instead of doing that, do your research. Masks work. There's several studies out there now. John Hopkins did a study, and, it's proven science that masks do work. So people need to focus their attention more on, getting that rather than, doing what they're doing.
Okay, report from county sanitarian.
Okay, what I wanted to talk to you about today is what happened at the election. So I attended the election at the fairgrounds, and I want to give a shout out to Leota for giving me some gowns to wear, because I was the person that helped people that had COVID make sure I was able to help them get their vote in, which I think was really important, that we did that for folks. There were 9 people that came through that were either in quarantine or were COVID positive. And so even though I was there 14, 15 hours, I did only help 9 people, but I think it was really important to be able to do that. But what came out of that was the fact that when we're approving these plans for events, we did I helped the election office come up with their COVID-19 plan. It didn't come to the Board of Health, but it was very similar to what we see on a regular basis. And it was not adhered to. When I walked in the morning when they were setting up, there was no one wearing masks, even though that was the standard, what they were supposed to be doing. I, of course, immediately said, mask it up. It's time to put masks on. And some people did and some people didn't. And it continued that way throughout the day. So as much as we try to come up with plans and put a lot of faith in these groups to do that, I didn't see it. And it was from this is at an entity that is actually a county. These people work for the county that should be enforcing it. And it was very frustrating to see that happen. People in the community came prepared, though. So I would say 99% of the people showed up with masks. But when they walked in and saw the very first person had a beard guard and not a mask on, immediately things digress. And so as we consider plans for events, we really have to call out the people that are sponsoring the events and make sure they understand that this is not something that we're just giving lip service to. It's important, and they have to get full buy-in from their volunteers, because that's what we weren't getting at the election, is we didn't have full buy-in by the volunteers that were there. And if we don't start with those folks wearing masks, the masks just go away, because some people are just embarrassed to have it on if they think that people are looking down, oh, well, they took their mask off, so I have to take it off or I'm going to look stupid. I'd rather see the peer pressure on that if we all have masks on, that's what, they understand that we all agree that it's the right thing to do. And I know I'm kind of preaching to the choir because we all wear masks, but I think it's important that as we move forward, that we really put that pressure on the events to make sure that they follow that. And if they do have people that don't want to follow it, they don't have to participate in the event. Now, I get it that it's a little trickier for people attending, and that's just where a lot of massaging and that is going to happen from the sponsors. But the sponsors and the volunteers have to adhere to it. Not 99%, not 98%, 100%. And if you have someone that can't because they're medically unable to do it, I would say find them another task where they don't have to be present in front of the public, because we have to show that we're all in. And that's kind of what we have to do in the courthouse on a daily basis. Everywhere we go, it's what we have to present, because that's who we are right now, is the bearers of masks. So I wanted to share that with you. We do get a email every so often about complaints. The state has it set up a COVID-19 complaint hotline, I guess, and so we get an update. I just got one. I didn't see who it was for, but I just got one today, and so I'll follow up on those complaints. Most of the time, the complaints are not necessarily the restaurant or bar, but that the people in there weren't wearing them. So the employees are wearing them, but sometimes, like the town pump. And I have worked really hard, and so has town pump. Town pump told me that down at Three Forks, she stood there, the manager stood there at the door and said, "Oh, do you need a mask? Oh, do you need a mask?" And people would just brush by her and say no and push on. And, it's very, there's that fine line between, as you know, pushing it that way. But I think most of our facilities are trying to adhere to it. And they just need reminders, and we just have to come up with solutions for some of them as well, and that's what we're trying to do. But so that's kind of my update on that. Any questions for me?
I just have something to add to that. But we did have one business in town that had 5 or 6 positive cases. And we call those a cluster. And so we've only had a couple of clusters, one being the hospital. And anyway, I think there were 6 cases that were all related to one facility, one business. So I think, I know that Lewis and Clark is really starting to crack down on some of those that are doing stuff like that. So I don't know, we're going to get the support from, our county attorney or our sheriff, but, if I'm getting 5 cases that are all related to one business, I think that we need to do something, because, it's not only just those 5, 6 people. In my world, that could be 50 people, because each person has, 10 contacts. So I don't know. I don't know what the answer is, but I think it's something that we need to look at, maybe cracking down a little bit on, because it's, and yet people say, well, it is what it is, it's just gonna keep going, and, so it concerns me though, several of these people were over 65, and that's always a concern when you start to get into that age group, especially when we're starting to have deaths in our county now. So
I'll just say one last thing. Thank you for bringing that up. The enforcement issue, of course, is is very difficult. And you may have read in the newspaper that Flathead County took 2 businesses to task on the fact that they were not following the order. And the judge kind of, if you read the newspaper, depending on which article you read, it said that the judge dismissed it. Effectively, the judge, my understanding is that the judge did dismiss it, but it was because the bars had implemented new practices, and so there was nothing, basically they started trying to do something more than what, and so the judge felt that was enough. That may be paraphrasing it significantly, so you may want to look into that. But what the impact of the article or the impact of that really has come down, and the sanitarians around the state have been emailing in this today about this. I've never seen where sanitarians just are all emailing each other, but today they're talking about how businesses are saying they will not comply because they think that the judge threw out the cases, and therefore there's no enforcement of the governor's directives. So that's going to throw a little curveball in things for people that are very anti what this is all about in terms of how we're trying to promote public health. So once again, it's going to fall on our shoulders to try to educate those people on how it really played out. And so we will continue the fight.
Thank you, Sean. Anyone else have any other comments or reports?
I just guess I should have put it up earlier, but I just kind of wanted to give a little bit report of what's going on with the hospital. So, as everyone knows, it's been in the paper that we have had positive at the hospital. And we have had residents and staff. The staff has been quarantined to home. Billings Clinic, they control our employees and how that works, and they're very strict about what happens with that process. And all the residents have been on strict quarantine since that first case did arise. We, just like Teresa mentioned, I talked to her this morning, we did have our first step, and it was one of our intermediate sling long-term care residents, and it was due to complications with COVID. But I just want to remind everybody, we have policies and processes in place to keep both our residents and our staff and the patients safe. We are doing surveillance testing on all the residents and staff on a weekly basis. In the beginning, when we didn't have any cases, we were doing that on a bi-weekly, but we are doing that on a weekly basis. So we are also continuing to work on a process to be able to allow these residents to come off quarantine here shortly, so that at least they'll be able to, come up with a plan to help them to be able to come out of their rooms. I know we kind of had a gown situation at the very beginning when this all happened, and it was kind of a miscommunication on different parts. We are allocated based on what our use is, but when our use went very high, then that made it difficult for us to get gowns. That's not an issue now. We actually do have a large quantity of the washable, reusable gowns, which we have put into effect. So that situation is good. But like I say, we are, doing everything we can to keep everybody safe, the staff, the patients, and the residents. And at this point, we are on the downtick. So hopefully we'll do some more testing, and hopefully this is on the way out. So,
okay. Thank you.
Does anyone have any questions or concerns?
Yeah, thank you.
And Teresa, thank you for all you do. I know Teresa and I try and work together, and when we do most of the testing for the county, most of the positive come from us. I mean, we, on the phone calls, when they even call to test, you've got to quarantine until you get the results. If you're positive, you've got to quarantine. You're going to hear from Teresa. She's going to want this information. And, you can tell people till you're blue in the face. But, they're hearing it from every direction. So, hopefully people will start listening.
Okay, thanks, Leota. Anyone else have anything?
I do. Yet another COVID thing.
I just need some guidance. Rod and Gun Club, that's who I'm representing this time, has an event January 2nd and 3rd, archery event. And it will involve people, mostly kids, so their parents will be attending with them from across the state. Originally, and it will be at the 4-H building. Originally, we had it set up that 32 stations, so 32 kids could shoot at the same time. We've revised that now. There will be only 12 and 2 judges, so 14. Knowing some of the parents will want to watch, we'll do it in shifts. But in that room, the 4-H building, we estimate at any given time it'll be 25 to 30 people in that room. So is that another COVID plan that the Rod and Gun Club should put together and get in front of you? We are under that. Okay.
Yeah, definitely now because 25 is
I know.
the number.
Yeah.
Yeah.
So where it was 50 before.
Right.
So now it's 25, so
Okay.
same
Same thing.
approach.
Okay.
But there's no guarantees. We haven't really given it much consideration since the directive just came out
know.
yesterday.
Yeah.
Okay.
So,
Late yesterday, too.
And we'll get that to you by Monday-ish. Again, email the group and go from there.
yep.
Okay. Because the Montana Archery Association, whatever, needs to start registering kids or families for that. I think their goal was December 5th or 4th or something.
Okay.
So that'll be on your radar then. Thank you.
Okay.
Thank you. Any other comment? Not, we'll entertain a motion to adjourn at 2:12.
I move to adjourn.
Second.
Motion's been made and second, all in favor?
Aye.
Aye. Opposed, same, motion carries.
Thank you, everybody.
Thank you.
Keep up the fight, take care of yourselves.
Have a good day.
See you, Dwight, thank you.
Thank you, guys.
Thank you.